Hello everyone, a very good evening to all of you. So in the morning session, I talked about a few cardiovascular disorders and we are going to apply the concepts now. Okay. So a 56-year-old man presents with severe chest pain, 1 hour with sweating, and ECG shows there is a slight or ST elevation is seen and there is a leads in 2, 3 and AVF. Troponin is positive. See, I'll look into the positives in this question. As we all know, ST elevation, this word if it comes, I will mark it as ST elevated myocardial infarction. And I will try to evaluate whether other statements are supporting it. See, the chest pain is for 1 hour. So if it is a stable angina, it will be less than 10 minutes. If it is an unstable angina, it will be 10 to 20 minutes. If it is a non-ST segment elevated myocardial infarction, it will last from 20 to 30 minutes. And if it is an ST segment elevated myocardial infarction, it will be more than 30 minutes. The chest pain will be more than 30 minutes. So again, 1 hour, it is more than 30 minutes. ST elevation, that's indicates the ST elevated myocardial infarction. And one more thing is troponin positive. Of course, troponin will be positive in cases of the non-ST segment elevated also. So troponin values, troponin T and I. Okay, should definitely know the normal values. Troponin T will be around 0.04 nanograms per ml and troponin I will be 0.02 nanograms per ml. So in this question, based on the positives, I'll go for ST segment elevated myocardial infarction. So moving on to the next MCQ, a 60-year-old man has chest pain at rest for 15 minutes. So less than 10 minutes stable, 10 to 20 minutes unstable angina. So I'll just try to fix unstable angina in my mind. And if you see ECG waves, there is T wave inversion. So ST depression and T wave inversion are features of unstable angina. And again, troponin is negative. So it cannot be non-ST segment elevated myocardial infarction or ST segment elevated myocardial infarction. It can be either stable or unstable angina. Stable angina less than 10 minutes, but this goes for 15 minutes. And in stable angina, you will not have ST depression. Only in treadmill test, you will have ST depression alone. But in unstable angina, you will have ST depression plus T wave inversion. So this points towards unstable angina. So I have talked about all these concepts clearly in the previous session. I'll just give you the link. You can go and watch it. Okay. A 60-year-old man with long-standing hypertension presents with breathlessness and orthopnea. So he has basal crepitations. So what happens? As I told you, any respiratory problem will be because of the left ventricular failure. Why? Because the blood is not pumped into the aorta. There is backflow of the blood from the left ventricle to the left atrium. Again, it backflows into the pulmonary veins to the lungs. So there's going to be orthopnea, there's going to be dyspnea, there's going to be paroxysmal nocturnal dyspnea, there's going to be asthma, all these kind of problems in case of left ventricular failure. Okay, so these patients are having breathlessness and orthopnea, and based on this, I'll go for this going to be pulmonary venous congestion because of the left ventricular failure. Okay, as I told, I've talked about all these concepts, so you can go and watch them. This is just a quick application of the concepts what we have learned in the morning. Okay, next question. A 55-year-old man presents with pedal edema. As I told you, pedal edema, systemic venous congestion. So the right ventricle is not pumped adequate blood into the pulmonary artery because of the increased pressure from the left ventricle. So what happens? The right ventricle fails. So the backflow of the blood into the right atrium, pulmonary, there's going to be superior inferior vena cava is going to be flooded with blood. Pedal edema, ascites, increased weight gain, jugular venous pulse is going to get raised. So this is because of the right ventricular failure. What is the most common cause of a right ventricular failure? It is a left ventricular failure. Next, a 68-year-old man develops acute breathlessness 6 hours after MI. Okay, he has a frothy pink sputum, bilateral crepitations. This is a classic of an acute left ventricular failure causing pulmonary edema. Okay, so pulmonary edema, increased accumulation of fluid in the lungs. Okay, so the acute left ventricular failure is going to cause increased amount of fluid, or it pushes increased amount of blood into the lungs, that is going to result in pulmonary edema. Okay, now moving on to the next MCQ. A 70-year-old man with a chronic heart failure has fatigue and decreased urinary output. Okay, so the urinary output is reduced because Very simple. See, when a body, has a reduced amount of, or when a body is under damage or any kind of a dangerous situation, it tries to cope up. So similarly, what happens when there is decreased blood flow, there's going to be decreased glomerular filtration rate. So when there is decreased glomerular filtration rate, the body tries to activate renin-angiotensin-aldosterone mechanism, RAS mechanism. So what is going to increase sodium and water retention is going to take place. So when there is increased sodium and water retention, obviously there's going to be decreased urine output. The compensation. Again, in heart failure patients, the body increases the adrenaline secretion, vasoconstriction. More amount of blood can be pumped up. So this is what is happening in cases of patients with a chronic heart failure. So body activates renin and angiotensin aldosterone mechanism, increase sodium and water retention, decrease urinary output. So this is about the MCQs from the concepts we discussed in the morning. The tomorrow session we'll be talking about another few disorders, and we will apply that in the evening session. So the evening sessions will be much faster because we have talked about all the concepts in the morning session. I'll just brushing it up the concepts in the evening session. So thank you so much for watching the video. Have a nice day.